Hi everyone, I'm Steve here again with Dr. Nario of Biointegrative Health Center in Reno, Nevada. You can check them out online. Pretty easy to find, Biointegrated Health Center. And if you want to reach out to me for any reason, you can get me at stevemain.com. So, thanks for being with us, Doctor.
Hi, Steve. Thank you for the invite again. Always a pleasure.
Okay, so we're talking about something that I really hear a buzz around the clinic, something that seems pretty exciting with all the variables. And it's like, I can't even think of all the questions I want to ask about this. So we probably want to do another one of these just on this topic. So I'll call it this ozone blood treatment. Now, you do an ozone IV treatment, but I understand it's different than what I would call this ozone blood treatment, where you draw blood out, a lot of it,
Hmm.
and you do stuff to it, and then you put it back in. So I don't want to misspeak, so I'll just let you say, what is it?
Right. So, Steve, what you're describing is what we call ozone MAH or major auto auto hemolytic transfusion of the ozone auto hemotherapy. There you go. I'm kind of lost
You
for
don't even
words.
know what the whole name is.
It's so complicated. I even lost myself in it. But anyway, so yes, this is actually not new. If you mentioned it's new, it's not really not.
Well, it's new to the clinic, I know that,
Yeah,
right?
so it is.
Yeah,
And the
that's what's
thing and the
exciting.
thing here is, we actually now have the newer version. So when you talk about it's old, it is old. It's being done out there, but we have the newer technology to do it, and that's why it's a little special in the clinic, and why patients are just clamoring about it, and also they're lining up to get the treatments. But anyway, let's go back to what it is. So first of all, basically, maybe the best way to start this discussion is what is ozone. So just to refresh the memory of our audience here, ozone is created in nature by lightning and can be smelled after a storm. So that funny smell that you feel or you smell. It's one of the nature's most powerful oxidizers, and ozone is created by converting oxygen into ozone or O3. So O2 to O3. And as you can hear that this is naturally occurring. But in the IV world, this is actually a gas that instantly reacts with your blood. When I say that it instantly reacts to your blood, it reacts to the cell wall or the fat layers of that cell wall. And when ozone gets, I guess, a connection or interacts with that cell wall, it actually triggers many chemical reactions. And these chemical reactions can be activating enzymes for anti-aging, or lowering down inflammation, and even preserving the life of your cells. So again, all the benefits of ozone therapy can be seen in this blood treatment, ozone therapy that we're doing.
Okay, so it sounds amazing. Um, and it also sounds, just talking to some people in the clinic and talking to my wife who's scheduled to get it, it sounds like there's almost an infinite amount of benefits. But can you talk about some of the benefits that this treatment will give someone? Or, yeah, what are some of the benefits?
Right. So, Steve, when you talk about again your blood getting, uh, I guess, bathed with ozone, so now you have to remember that bacteria, fungus, viruses, any infection in that blood will actually be deactivated. And also, when you infuse this blood that is now rich with ozone, it actually indirectly activates your immune system that is down. And we even use this for patients who has damaged nerve endings, because it actually has proven to help regenerate these nerve endings. And also, detoxification is one, which also corrects the activation of the processes of the liver and the kidney. And again, going back to our audience, the audience is more of the athletes, and also with the vasodilating effects of the of ozone. you can actually see improvement of your circulation, the micro, the peripheral circulation. It also increases the cellular efficiency and activation of oxygen dependent processes. So, aerobic oxidation for athletes who are running around doing all these exercises increases the mitochondria, and also respiration, thus increasing ATP formation.
Wow. It sounds like you could probably go on. So, can you talk a little bit about I know you talked about the ozone IV treatment,
Mm-hmm.
but how are they different? In what way are they different as they affect the body? You're
Right.
doing something to the blood, an IV ozone. I mean, you're putting something in the blood. Can you talk a little bit about the difference?
Mm-hmm. Yeah. So yeah, it's not your typical regular IV drip. So let me kind of just reimagine it for the audience here. A regular IV drip, of course, a single solution, an IV bag that you add medicine into it, vitamins, EDTA, peroxide, and infuse it. Once it's infused, it's done. But for this specific procedure, IV blood ozone or MAH, we draw a certain amount of blood out of the patient and we put it in an IV bag. And in that bag, also mixed with saline and carrier solution, we put also heparin in it because you don't want that blood to clot so that it can be reinfused back to the patient. And infusion of the ozone now happens once these two mixtures in the bag had occurred. And then you add ozone in there to now reozonate the blood. So when you see the interaction of the gas in the blood, so it's dark blood initially. And as ozone now touches it, it turns into light pink, meaning the red cells now increases its oxygen content, charging up these red cells, giving it more power, giving it more capacity. Even the white cells are more active. And then once this reaction is brewing up in that bag, now you drip it back to the patient. But even before that, that blood will pass through UV laser lights. And this is one of the special feature of this procedure. And that's why I was telling you when I was comparing it to the older version of ozonated blood getting infused, they don't have these UV laser lights that actually adds more of a twist and more benefit to the whole therapy. So it's not a one-step process, again, as you can see, but the good notable effects are very evident and sometimes even immediate.
Wow, and it makes your blood turn pink, not green. So, a quick question: how much blood do you draw out? Like, compare it to if someone's going to give blood. Would it be twice the amount, or would it be about that amount? Or I'm just curious.
Right. So the blood really depends on the therapeutic target that you want to achieve for the patient. So there are procedures that you only get 100 mils of blood. Some will be 300. We even have an upcoming one that would get 2.52 liters of blood out of the patient to basically add all those features that I mentioned a while ago. So it really depends on the need, and also when you talk about that, the access of the patient, meaning the how good their veins are, how big they are, and how much blood we can draw out of that.
So, in perspective, I mean, how would that compare to like how much blood you give, how much they draw out? Is when you say milliliters? I mean, how much is that? I mean, like comparatively.
So when you talk about well, if you're talking about so the amount when the easier way to really look into the quantity of that is of course 1 gallon is almost like 4,500 milliliters, so it's basically not reaching enough as big as a gallon of blood. uh,
Wow.
but definitely maybe a good parameter would be more of a liter. So for 1 liter, you have at least 1,000 mils. So you could see we can go as far as 1/4 of that 1 liter. So 25% of the 1 liter.
Okay.
That's the we can go as far. That's minimum. We can go higher.
Okay, so you obviously this can be used for a lot of things, and you can target specific things. Um, so I mean, I would think autoimmune disease, Lyme disease. I mean, cancer. I mean, everything. But what would you mix this with? What combinations would you use with this treatment, or how would you make it different for one specific target compared to another, and what would make those targets different? I mean, what would make the substance or whatever you mix with this treatment, what's different?
Well, Steve, that's a good question. We always have patients like, what can I add to this? What can we mix with it? Well, there are so many. There are many possibilities that, again, as you said, we need to have another session for that. But one special mention that I need to put out there as early as now is the UV laser, which is the UVBI. So it's ultraviolet blood irradiation, as we call it. That's the meaning of the acronym. Why is that? As you let that ozonated blood pass through these laser lights, now you actually have germicidal effects. The blood that passes through there, now whatever organism is there is also going to be destroyed. Immune modulating effects. It's revving up the immune cells that are in that passageway, or what we call like a catheter, or a quartz catheter that goes through that laser light. Increases the oxygenation, lowers down the inflammatory markers that's in that blood, and also, even this is something good. I know you're pretty big about this. Regulates the autonomic nervous system, or the vagus nerve, and it has some neurotransmitter effects on the brain. Also, lowers down pain, cardiovascular effects is improved, and even for especially for the athletes, increases the vasodilatory effects in the microcirculation that we have, and also increases the oxygen that we use. And again, we always hear about the UVB and UVA lights because they are the ones responsible for modulating the immune system. But the thing here is, the most special one here is the UVC light, which is actually the one that's germicidal, kills the bacteria, viruses, fungus, and yeast in relation to this light exposure. And again, killing all the pathogens in the blood that is causing any immune disruptions. So this is why the light needs to have a special mention about this when you ask that question.
Okay, so do you always use the light with this treatment?
Yes, always. That's one thing
Okay.
that you have to remember, that this procedure plus the ozone, plus the ozone ozonated blood, it actually increases the effects of the therapy by almost 30 to 40%.
Wow, that's a lot. Okay, so I have a hundred questions, but I'll just ask one more.
Sure, sure.
So, how would you make this treatment different for somebody that has a specific illness or sickness compared to someone who has a different sickness or illness?
hmm So that's a good question. So now there's so many ways. As I mentioned to you a while ago, you have the ability to now adjust the blood that you want to remove out of the patient and add ozone to, and clean through the UV lights. Another one would be the amount of ozone that you can give in there. So you have the ability to adjust that to a higher dose, to a lower dose, and that's why there's so many ways on how to individualize a therapy. And also another one would be, you ask that question, what IVs can I do with it after the actual ozone blood treatment? Yes, you can definitely add another IV depending on what the condition is. So there are three ways that you can see that we can play around and modify this therapy.
Wow. Okay, so you would normally do the IV treatment after the ozone blood treatment?
Mostly we do the yes, this oh no, let's go back to that. The first would be this one, getting the blood out, and then the next bag would be the one that we make through medication. Like if you want a peroxide, you want to see. So it usually
Okay.
goes that way.
And then you would put the blood back in?
Oh, no, no, no. You finish the whole procedure first, meaning
Okay.
get the blood
Then
out,
you could then you
ozone.
could go so after you do the whole procedure, then you could go do an IV.
Yes, it's almost like we don't have to repoke the patient anymore. We're going to use that same access.
Okay.
Hmm.
Very interesting. Well, I want to talk to you more about this for sure. Um, that's a ozone blood treatment is kind of what I called it. That's Dr. Nario Biointegrative Health Center. And what if they want to know more about this treatment? Should they call? Do they set up an appointment? But what if I'm not a patient and I want to know more about it and I say, I want this? How would I go about that?
Right. Well, Steve, definitely our lines are available. All our staff is knowledgeable about it. If they call us, definitely all of us are ready to answer questions. But if everybody's looking at Dr. Google here, so you can definitely type ozone UVBI therapies, and that alone has a ton of information for everybody to see.
Okay, but what I'm saying if they're not a patient and they want to be a patient, I mean, you're taking new patients, right? What do they
Oh
do?
yes, yes, of course. We definitely want to accommodate everybody for this, and this is such in high demand. And yeah, we will make sure that everybody gets attended to, and we'll help them out.
Okay, call and make an appointment and go from there is how what I take it. So
Yeah.
uh, it's Dr. Nario Biointegrative Health Center in Reno, Nevada. Thanks for being with us, Doctor.
All right, Steve. Thank you so much again. And as we all know, the knowledge is power. And thank you for letting me provide you with the edge in longevity and health maintenance, which I call the biological edge or the bio edge.